Hello, I am Dr. Nischal, a dermatologist practicing at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Red dots on face many a times is because of acne. Acne can not only present as big nodules, but it can also present as just red spots on the face. Or it can be a sequel of acne healing. We call it as post-acne erythema, where people develop a lot of tiny redness, red spots after the healing of acne. Sometimes they have small depressions in those areas. So when we recognize these things, we treat them more aggressively, because it's always better to improve a scar when it is red or it is still in the healing process. The results are much better than when a scar is all pale or when it is dark in color. Other causes for red spots on the face can be a simple sweat rash, or it can be because of sometimes dandruff-like reaction, which can happen on the eyebrows, it can happen on the nasolabial folds here, beard region, or on the forehead close to the hairline margin. Or the rest, red spots can also be because of viral infections. Many times red spots happen either during the phase of infection, the fever, or once the fever subsides, people develop the red spots. It can be because of any of these things, in addition to one big thing is medicine-induced allergy. So it can be painkillers, it can be some antibiotics or some other medications you may take for any other reason. So anyone can develop a reaction to any medication, and many times it is not predictable. You would have taken the same medication like n number of times, and one last time it gives you a reaction. So medicine is also one of the cause for red spots on the face. In addition to this, many a times people develop a lot of red spots on the face because of abuse of steroids. When people desire to become very fair or to remove the marks or to control the acne, start using a lot of steroid creams which are not actually suggested, and they end up having a very red skin. So that's called as telangiectasia, or a sensitive skin. The moment they're out in the sun, it's all red. So these are some common causes for the red dots, and the treatment is based on what exactly is the cause. By judiciously taking care of the oily skin, we can target not only acne but also a little bit of dandruff reactions which give redness on the face. In addition to this, the hygiene is very important. Washing the face at least thrice a day is required, because you need to remove all the sebum, dust and everything, so that you don't get a lot of sweat rash. This is especially important in people who are into a lot of sports or gym or any other physical activity or some dance. So that the skin has to breathe, it has to be kept clean. Coming to the sun reactions, which can give rise to a little bit of redness, so that has to be effectively treated with some medications, because it can give rise to pigmentation, and as a prevention thing, you need to use a sunscreen. The redness which happens because of the steroid creams takes much more time to reduce. In fact, the skin will look dull for a few days after the stoppage of the medicine, and the skin is a little bit sensitive. So usually these patients are put on sensitive face washes, creams which are for sensitive skin, a lot of sun protection thing, and once they get used to that, some procedures are also done to improve the overall skin tone and texture.